right, I'd like to introduce our speaker for today. Our speaker is Mike Eden. Mike is a licensed clinical social worker, a licensed clinical alcohol and drug counselor, a board-certified sex therapist, and a certified sex addiction therapist who is a graduate of the University of Louisville's Kent School of Social Work. He has worked in mental health and substance abuse treatment for the past 10 years in both inpatient and outpatient settings. He is currently a PhD candidate at the International Institute of Clinical Sexology, and his dissertation is focused on testing an interactive educational program for parents designed to improve their abilities to address screen use compulsivity in their children. Mike currently works full-time in private practice, focusing on cases related to traumatic bonding, process addictions, and complex trauma. He specializes in an active treatment approach using eye movement desensitization reprocessing and other experimental therapies and a task-centered addiction treatment model. So that's very interesting background for us. And Mike, I'm going to turn it over to you to start your lecture on screen addiction.
All right. Thank you, Mark. I'm going to get the presentation pulled up here. All right. Well, my name's Mike, and I'm in private practice here in Louisville, Kentucky. And how I got into this work, working with screen addiction, was back in 2018. I started a program to get trained as a sex addiction therapist. And that was when I really picked up the skills and education necessary to treat process addictions. And then fast forward to 2020, when COVID and the pandemic and quarantine hit, all of a sudden I'm getting tons of calls from families, specifically around having issues with their children when it comes to gaming or social media or pornography or texting, etc. So my expertise in this area really came out of necessity as a result of that. So most of the content that I'm going to talk about today is definitely going to be focused on young people, because that's mostly the folks that I'm treating in this area. However, all of us, because of the way that technology has become really a kind of a necessary, inherent part of our modern world, everything I'm talking about today is probably going to apply to all of us to some degree. So I'm definitely going to talk about screen addiction more so on the severe end of the spectrum, but some of the principles I talk about in terms of treatment and prevention likely will still be applicable to folks who are in a less severe category. So the objectives for today, I'm going to talk about some of the current diagnostic information we have that is relevant to screen addiction. It's still not great at capturing it, and I'll talk about that a little bit. I'm also going to talk about some of the developmental consequences and some of the research that's been done about the impact of excessive screen use on the developing brain. And then at the end of the presentation, I'll talk about kind of a broad conceptualization of what treatment looks like for screen addiction. And I'll also talk about some prevention strategies. The prevention strategies I talk about will also be listed in the handout that all the participants will get access to after today. This is a slide just to get a little bit of a baseline of some data when it comes to screen use. So a couple things I'll point out. Kids ages 8 to 12 in the US spend 4 to 6 hours a day watching or using screens, and teenagers between 13 and 18 spend up to 9 hours. According to a CNN report, the average American adult spends about 10 hours and 39 minutes a day on screens. That's also factoring in the amount of time one spends using technology during work. Half of children in industrialized countries have a personal tablet. So these are just some baseline references. And I always just give this disclaimer that that data is helpful in one way and not so helpful in another, because not all screen use is created equal. So the way that this data is being captured sometimes lumps all screen use in together, and that isn't a great representation of what might differentiate the average person in the population versus someone who has a screen addiction. It's not just about the amount of time we spend interacting with all technology, more so how much time and in what way do I have a relationship with technology that's highly stimulating. The first piece with screen use that I'll differentiate is the difference between passive and active screen use, or interactive screen use, excuse me. So passive screen use is I'm interacting with one device at a time, and that device is away from my body at least 6 feet. And, in most cases, this would be like a television set up against the wall. And I'm not actively manipulating the experience I'm having there. There is content coming across to me, but it's happening passively. So that would be like a movie or a TV show that I'm watching, and I have no other screens in my hands at the same time. Now, I don't know about you all, but for me, most of the social situations I find myself in, even while watching TV or a movie or watching a game, most people either have their phones out or in close proximity to be able to use at the same time, and that would not be passive screen use. So interactive screen use is essentially everything else. So the one of the key differences is that with interactive screen use, whether I'm using a handheld device that I'm touching or tapping with my hands, or I'm using a remote control of some kind to manipulate a console, it's more stimulating because I have the ability to actively manipulate the kind of content I'm engaging in. It's also typically more stimulating because there's more likely to be quick changes in the content that I consume, whether that's because they're really short reels that I might be watching, whether that's TikTok or YouTube or Instagram, or I'm engaging in an internet video game where I have the ability to manipulate the experience, and there's lots of quick changes happening that way. With interactive screen use, we're much more likely to see an increase in nervous system activation, which I'll talk about in greater depth later. It's also more likely to activate the addictive process because of the amount of dopamine that can get produced and the quick changes in the level of arousal in our body associated with that. I'll also spend some time talking about how excessive interactive screen use is more likely to put the body into a chronic stress state, especially for children. So I like to start with this case example just to create a bit of a clinical picture of the kinds of situations and kind of core tenets of client presentation with some of the folks that I've treated. And this is based off of a couple of real cases. And of course, I've changed the necessary information to keep the person's confidentiality. So this is Eli. Eli is a 14-year-old heterosexual boy and lives with his parents and his little brother, Jordan. Eli started using an iPad for gaming and watching YouTube videos when he was 7. Started out being a shared device in his home, but eventually became his personal device he was able to use freely. He also enjoys playing massive multiplayer online role-playing games, which would be games like Fortnite or World of Warcraft, on his Xbox, chatting with his friends on apps like Discord and Snapchat, and spends time browsing Reddit to learn about games that he enjoys. Eli used to love swimming and was a competitive athlete for his age group. Eli also was at one time a strong student and found school easy to navigate. In the last 2 years, Eli's screen use has grown exponentially. Once home from school and through the obligatory 1-hour homework period set by his parents, Eli games with his friends. Most days, he spends at least 3 hours gaming, and on weekends binges for 4 to 8 hours at a time. While attempting to work on homework, also done on his iPad, Eli finds difficulty concentrating and often compulsively watches YouTube videos and switches frequently between a series of apps instead of completing his work. Eli discovered pornography for the first time while chatting in a Discord group and has noticed a quick escalation into content areas he finds disturbing in hindsight. Eli's parents became increasingly frustrated with their inability to set limits with his screen time and noticed that he became progressively more angry, irritable, and at times violent when told he had to stop gaming or surrender his phone. After developing a tolerance to pornography alone, Eli began sexting online with people he met on Discord. Eli also began having extreme difficulty concentrating during school or at home doing homework and was diagnosed with ADHD. Eli's sleep became grossly inconsistent due to his nightly binges, and he found it difficult to stay awake during school and social functions. Eli's parents called a therapist after he got reprimanded at school for pressuring a classmate to send him nude photos of herself. So sometimes when I give this presentation, that I've gotten feedback that case sounds really extreme. And in it, it houses some of the core tenets of what are like really common precursors to treatment for someone who has a screen addiction. Some that I'll point out are things like a significant drop in interest in activities that are non-screen related, especially when there was interest in those activities before. What are the two most common precursors to treatment for a lot of young people specifically that I see with screen addiction are that there is some kind of what seems like random out of character experience of violence or threat of harm to self or others in relationship to having some kind of limit set with screen use. So maybe the screen use has gotten out of control and the parents take all the screens away, and then there's this huge eruption or what seems like an age-inappropriate tantrum that happens that might include violence. That's one. The other is some kind of consequence related to sexting or the exchange of erotic content in some way, whether that's because they get in some trouble at school or the school finds out about it, or the other family involved protested in some way. That's another really common precursor to treatment. One other thing I'll mention about the massive multiplayer online role-playing games is what makes those games different and ultimately more addictive is that there is no end to the game. So 20 years ago, most of the video games that were created, you would go through a series of levels and eventually you would beat the game, you would finish the game. If there's endless worlds to explore, that means there's endless novelty. There's endless new information to be pursued. And novelty is one of the primary change agents of dopamine. So it's part of the reason those games can become a lot more addictive. So when it comes to diagnoses, there's two coming down the pike that I think are likely to be in the next version of the DSM. One is compulsive sexual behavior disorder, and the other is internet gaming disorder. If we look at both, and at the moment, both are included in the conditions requiring more research in the DSM-5, and the ICD-11 has already included both. So again, I think there's a pretty good chance it'll be in the next version of the DSM. These are the criteria that they proposed for internet gaming disorder. There's 9. A person has to have at least 5 of these happening within a 12-month period. If you look closely at these and you're at all familiar with substance use disorder or problematic gambling, you'll notice that the criteria are exactly the same. Preoccupation, withdrawal, tolerance, inability to stop, negative impact on community, school, social, and work environments. It's pretty much the exact same criteria that we're using for substance use disorder. I'll zoom in on a couple of these just to give a bit of a picture of how this might show up. So with preoccupation is there is a primary mental fixation on this behavior, which means I think about it more than I want to be thinking about it. I think about it so much that it prevents me from being present in other areas of my life. It's going to show up, and you'll notice it more when access is restricted. If I have unlimited access, the preoccupation is going to be less noticeable. But if all of a sudden, if I've had access to 8 hours of gaming a day and I can always use my phone whenever I want to, and there's suddenly limits placed on that, then the preoccupation is going to become really obvious. Which is true for other addictions as well. It's always more intense when there's some kind of restriction placed. Withdrawal is going to show up more psychologically than it does physically. And typically what that looks like is, for a lot of folks I work with, withdrawal in a screen addiction can look like when I don't have access, or I don't have access for long periods, specifically like in the morning when I have to go to school or I have to go to work. Those folks are typically going to appear more flat and listless, kind of increase in depressive symptoms. They're not going to have a lot of motivation, a lot of, in extreme cases, almost like anhedonia. Tolerance is I need more. I need higher and higher levels of stimulation, whether that's I increase the frequency, I increase the novelty in the way that I engage screen use, or I bring in additional screens, or pursue different content, or I increase the level of risk associated with the behavior, which would be for a lot of kids is, gaming or accessing screens when I'm not supposed to. The increase of risk also influences the amount of dopamine that's produced. And what can go tandem with that is what are these kind of extreme methods of attempting to gain more screen use or manipulate my way around boundaries. I've had some families I've treated where kids have gone through the house and put together old computers or pieces of old computers together to get one that's functional, or finding old phones that have been sort of decommissioned and forgotten about and firing those up, to colluding with the neighbor kids to keep their accounts online so that they can talk through the window and figure out what's been going on online since they lost their own access. Those would be examples of extreme methods to continue use. These are the criteria that's been proposed for compulsive sexual behavior disorder, which would be potentially a diagnosis that would be relevant to sex addiction. And why I include that here is that for the most part, I have, it's been rare for me to run into a person who is addicted to one kind of screen use, like they're only addicted to gaming, or they're only addicted to social media, or they're only addicted to pornography. It's more common that it's a sort of a collection or a smattering of a bunch of different behaviors. So I think this would be helpful in the sense that it's a slightly more accurate diagnosis. I don't like that it's currently being listed under impulse control disorder. I don't think that's congruent. I think it really fits neatly into the other addictive disorders like substance use disorder. But if you look again closely at the criteria, very similar, if not exactly the same, but just kind of lumping a couple of different criteria into 5 as opposed to 11 like in the DSM. These I include, in and of themselves, each of these doesn't necessarily mean that somebody has a screen addiction. They're just like common indicators that exist around the person. Those would be insomnia and chronic sleep issues. Part of the reason for that is with the devices that we use, when that blue light penetrates our eyes, it suppresses melatonin production. So melatonin is the hormone that's released that helps us to go to sleep. So if I watch a lot of TV, or I game, or I'm on my phone, or I even have my phone inches away from my face scrolling late at night, especially if that happens habitually, that's going to have a really negative impact on my sleep. Even if I'm able to fall asleep, it's going to have a negative impact on like real deep restorative sleep happening. Rapid weight loss or obesity is also common. So with screen addiction, the more severe it progresses for most folks, typically there's going to be kind of a parallel of my life becoming more sedentary over time. So that's where you're going to see the weight fluctuations. I mentioned earlier the age-inappropriate tantrum piece. So a lot of raging or violence or aggression around limit setting when it comes to screen use limits. I hear lots of stories from parents of them having to sort of wrestle devices away from their kids and go to extreme methods that sometimes become aggressive to make that happen. The underpinning of that behavior is a real low-level tolerance for distress, or a complete absence of distress tolerance, which basically just means that my ability to be in my body and experience emotional pain is very limited. I avoid that experience at all costs. I keep myself very distracted and very stimulated as much as possible with a variety of different screen use to keep myself out of my body. So anytime I'm in a situation that I have to be in my body, it's probably going to be pretty difficult. An example I give of how this can show up clinically is, it's pretty common with addiction treatment that we might use some kind of mindfulness technique with clients. And if you're working, in my experience, if you're working with someone who is an active screen addiction, and you put them in a situation to be still in their body and then focus on their own internal experience, what that's going to result in is something close to panic for that person. Because what mindfulness does is it creates the exact situation that they compulsively avoid. So that can be challenging in the early parts of treatment. What else do I want to mention here? difficulty with screen time or headphones at meals. So looking at what people do while they eat and what they do prior to sleep or during sleep can be a good initial kind of screening tool for figuring out if someone has a screen addiction. Most folks who have screen addictions are likely going to be using screens during meals and in and around sleep. The last thing I'll mention here that I'll go into greater depth later is that there's going to be a really significant impairment in executive functioning that's not better explained by ADHD or a sensory processing disorder or autism spectrum. Differential diagnosis in this area can be tricky, and I'll provide some best practices that I've found related to that later in the presentation. So I've mentioned dopamine a little bit already, and there's pretty much no way to talk about screen addiction and not talk about dopamine. I won't go into great depth here because I know most folks, or I believe all that are on this webinar, are in mental health treatment to some degree. What I will point out is just that the natural behaviors that we engage in, like food, sex, exercise, and social belonging, that produce dopamine, that happens because our species has evolved over time in such a way that it's learned that if we tag those experiences with this pleasure response, we're more likely to do those in the future and to continue to do those as much as possible, which is helpful for the survival of our species. So if we do those 4 things in balance, eat, have sex, exercise, and connect socially, we're more likely to survive. And then when we bring in a behavior or a chemical that produces a ton of dopamine, what that results in from our brain's perspective is our brain interprets a huge dopamine hit experience as having some kind of evolutionary benefit. So I'm going to pay attention to everything I did leading up to that moment to make sure I can recreate that experience. And what our brain is also going to start to do is it's going to start to tune out all information that's going to prevent me from getting more of that thing that produces all the dopamine. And this happens whether it's drugs and alcohol or sex or screen addiction, same thing applies. So for a kid, if we think about that from their perspective, I have access to this highly stimulating content, whether it's gaming or social media or pornography or all the above. And my brain is having this hugely rich dopamine experience every time I engage in that material. So I'm going to start to naturally, as a result of the evolution of my brain, I'm going to start to naturally tune out things like other activities that are non-screen related. I'm going to start to tune out relationships, especially relationships with people that require me to be connected and in my body to maintain them. I'm going to start to tune those out. I'm probably also going to start to tune out the less stimulating things that I have to engage in, like school and learning. Not because I have some moral failing that has me not be interested in those things, but because my brain is engaged in an unconscious automatic process that has me naturally avoid those things to continue pursuing the stimulus that is bringing the dopamine on board. Covered most of this. One other thing or a couple other things I'll mention here. Rhythmic novelty seeking is a fancy way of saying scrolling. So when we scroll with our hand on our phone, looking at Facebook or Instagram or Reddit, whatever it is, the news, whatever it is you might be scrolling, the action of scrolling is my brain pursuing new information. It's pursuing novelty. And it's doing that because the more novel information I pursue, the more dopamine is released, which is part of the reason why when we scroll for too long, you're more likely to start to lose time or lose track of time. You're more likely to become distracted and not able to keep your focus on one thing at a time, or what is the thing that you're wanting to keep your primary focus on. You're more likely to become distracted. And apps that are more popular now, and TikTok is just a good example. These companies hire teams of psychologists that find ways to make their content as addictive as possible. And part of the reason TikTok is so addictive is because it gives information in very short bursts, 30 seconds or less, highly stimulating content and graphics and music. And the ultimate piece is that there's no bottom to TikTok. The algorithm will continue to suggest material based on the stuff it already knows that you like. And therefore, you're more likely to stay there longer because there is no end. You're never going to reach the bottom of TikTok. So there's endless novelty. I got a couple teenagers that I treat who are specifically addicted to TikTok. But another kind of more current thing that's happened in the last few years is that a lot of internet games, especially more popular ones, have found a way to embed gambling into their games. One way that happens was something called loot boxes. So what a loot box is that, let's say I'm playing a game and I kind of find my way through the first couple of levels. I develop some skills, but then I hit a bit of a ceiling where I keep playing the same level over and over and I'm not able to get past it. But there's this loot box or kind of treasure box that I can buy where I get access to a bunch of different tools or skills or weapons in the game that might help me to progress to the next level. But it costs, $3.99 or it costs $5. The catch is that I don't know what's in the box. It's a surprise, hence gambling. So that's another way that these games have found a way to increase the level of addiction associated with it. I've had a couple calls from families where their kiddo has found a way to sync their credit card up with their gaming system, and they spent $1,000 in one evening buying loot boxes. So that sort of thing is definitely becoming more common. Another reason why interactive screen use can become so addictive is because it has with different kinds of screen use, there's different ways that we can use that to regulate our mood. I'll give some examples. So one would be arousal. Arousal doesn't have any sexual connotation to it. Arousal is talking about an influx of activation in our nervous system, which is sort of getting revved up, things moving fast, a high thrill, high adrenaline. That would be arousal. So that could be internet gaming. It could also be use a bunch of dating profiles and get lots of interaction with lots of people, or I put a post on social media that gets lots of likes and lots of interaction. That can be a kind of an upregulated arousing experience. It can also be used for satiation, which is about getting numb, slowing things down, getting numb, disconnecting from my body. So common form of satiation would be I put on a Netflix series that maybe I've seen before, or a movie I've seen before. You might have heard people reference like having a comfort show. That would be an example of a satiation. So I put on a comfort show and I'm also on my phone scrolling. So there's two screens, two levels of stimulation that are going to have me get out of my body. And the longer I do both of those, probably the more numb I'll become. And the third is fantasy. Fantasy is about finding a way to escape painful or boring pieces of reality to go into worlds that are more stimulating or more fantastical in some way. If we think about that for a moment, internet games, pornography, and social media all house components of these really compelling themes in fantasy. A really common one in internet games is the archetype of the hero, right? So I get access to a way to have lots of skills and abilities and feel myself having a great level of influence over my environment. That has a lot of positive benefits, especially for a young person, if they're not really experiencing some of that in, quote, the real world, where they're able to have influence over their environment, they're able to develop some mastery over certain skills. If that's not happening, they're going to be more vulnerable to wanting to capture that experience or bottle it up in an internet video game. Social media also allows us the ability to sort of curate and fabricate a certain version of ourselves that we can try and get reinforced through the internet, again, by likes and a sense of desirability from others. And pornography, of course, is, especially with internet pornography the way it is today, there's no reason to need to pay for pornography because there's virtually limitless amounts of it available for free. And because of that, there's endless fantasy to be pursued. a great quote that I found, and I wasn't able to track down the originator of this, but people go online for what they get to do originally, and they stay for who they get to be. And for most of the folks I treat who have screen addictions, a significant portion of their identity has gotten connected to the way that they exist on the internet, which is definitely something to be untangled in treatment. So I include this slide because it's a way to differentiate how most young people use screens as opposed to older folks. So for those of you who might be on this webinar right now and you didn't get a cell phone until you were out of high school, chances are you have the ability to use different devices for different functions. You might use your PC or laptop for work. You might use your phone for social connection, and maybe you use a TV, a tablet, or a gaming console for entertainment-based things. And you can sort of create some compartmentalization between those different forms of screen use. Most young people I know do not do that. There's a couple of reasons for that. One is with smart technology, whether it's smartphones or smart TVs or tablets, most of them have access to all the same applications on that device. So there's not really a reason to have separate devices because I can get access to all the same stuff on each one. Because of that, there's this sort of bleed through effect where all access to technology becomes focused on one particular thing. And that one particular thing is going to be the most stimulating content that I'm used to having access to, which looks like if I'm used to getting on Instagram or watching YouTube videos or gaming on my device, and I happen to use a similar device for school, even though I'm supposed to be doing my homework on that device, all the associations that my brain has created with that device and the kinds of experiences I have there, all that's going to fire at the same time, even though that's not the current context that I'm using the device in. Another factor that increases the significance of this problem is how screen dependent our educational system has become, and at earlier and earlier stages in education. So it's not uncommon now for a lot of families I treat that their kids in elementary school might have to have a Chromebook or a tablet to do certain activities, which is a significant problem for folks who get more screen addicted. The analogy I often use for this is if you took someone who had a chronic case of alcoholism and you had them take the SAT in a bar, chances are they could take the test, but their brain is going to be so highly triggered by all the environmental components of that place and the kind of experience that they're accustomed to having there. Chances are they're going to be pretty preoccupied while taking that test, and they're not going to, their executive functioning is definitely going to be compromised for sure. The same is true for children who are used to using their devices for highly stimulating content and then use a very similar device to do schoolwork. So I'm going to spend a little bit of time talking about our nervous system and how we're set up for things like attachment, and then I'll talk about how that is impacted by excessive screen use. And I'm going to mention some other people's work in this area. So one way that our nervous system has evolved over time is to keep track of fast, quick changes in the environment, loud noises, bright colors. And the reason for that is, if we flash back thousands of years ago, if a twig snapped 50 feet behind me, I would need to be able to notice that sound and then very quickly mobilize my body and pump oxygen and blood to my major muscle groups so that I could potentially defend myself against a tiger that might be chasing me. That's why our nervous system has evolved that way over time, is we need to be able to pick up all that sensory information and react to it very quickly in order to keep ourselves safe. On the base level, what that means is when we have a lot of quick changes in the environment or bright colors or loud noises all at once, it causes an increase in activation in my nervous system up more towards what fight or flight feels like, because that's what my body is accustomed to doing in those situations. If we think about interactive screen use, and some good examples might be recent action movies that come out. If you guys are watching any of those, sometimes the brightness of the colors and the quick camera angle changes and the loud noises can be very stimulating, even though my body is sedentary. And that's a little bit of a snapshot of what might be happening to someone who spends a lot of time internet gaming. For young people, especially, if I'm getting lots and lots of that access over time, what that does is that because of that increase in activation of my nervous system for too long and that abundance of cortisol, the stress hormone that's in my body, it kind of activates this chronic stress state where my body is constantly working to keep itself alive and survive, even though it might not be moving very much. I'll reference someone's work here. That last piece is based in Dr. Victoria Dunkley's work. She wrote a book called Reset Your Child's Brain, which I would highly recommend to anybody who's parenting children right now. She breaks down a lot of this educational content in very palatable terms and provides some good suggestions. So definitely want to recommend her work. Let's see, I've talked about the melatonin piece already, so I'll move ahead. Something else I'll talk about is task switching. So the idea that humans multitask is a myth. We task switch. And what task switching means is when we move from one task to the next, even if we're seemingly doing multiple things at the same time, what's actually happening is our concentration shifts from one thing to another. And when it shifts to the next one, little pieces of our concentration are left at the last place that I just was. And when we do that repeatedly, there's a parallel diminishing of our ability to keep focus on the primary activity we're attempting to accomplish. So an example of that would be, let's say I'm typing an email for work, and I start typing the email, and my phone vibrates, and I get a text, and I quickly respond to the text, and I go back to the email. And then I remember that my friend had sent me a link to a song I wanted to listen to. So I pull up YouTube and I check out the song. I listen to it for about 30 seconds. Then I go back to the email, and then my phone pings again, and it's a Snapchat from somebody in my family. And I look at that, and then I'm back to the email. The more times I go through that series, the more time it's going to take me to have the kind of focus I would need to complete the task. And that's Daniel Goleman in his book Focus goes into a great level of depth about some of the machinations in our brain when we task switch for long periods of time. One thing he highlights that I think is very relevant to folks who have screen addictions is that chronic task switching causes this abundance of neural activity in the brain. And what he's referencing there is that it's basically a lot of classical conditioning that occurs where everything that I'm accustomed to happening on this device, all the different apps that I might use, every time I pick that device back up, my brain has associations to all those different activities I'm used to. And so when I pick that device up, even though it's to work on a paper or write an email, all those other activities are going to fire up, and all the regions in my brain associated with those activities are going to fire up. So I'm much more likely to become distracted and start to ping pong between a bunch of different apps. And again, that's part of the reason it can be really challenging for kids in school. All right. So another core principle of how our nervous systems are set up is that our nervous system is not designed to regulate itself, which means my body and my brain is not set up to become disturbed or become upset or become anxious and then go inside and find some way to work that experience out for myself. That's not how we're wired. What we are wired to do is to become upset or disturbed and to turn and engage with a larger, ideally more stable nervous system that I can borrow stability from. And ideally that person, a caregiver or a parent in this case, might talk to me in soothing tones and hold me close and hold me close in their presence in some way that communicates a sense of safety and warmth. And if that happens for long enough, my nervous system is going to start to soothe and slow down and not become so activated. That's one example of co-regulation. The reason I mentioned this in this presentation is that this is a really best way for me to say it is it's sort of a bifurcated factor when it comes to screen addiction, meaning that if there's not a lot of safety and connection with other people, I'm much more likely to lean towards finding ways to what we would call auto-regulate or regulate myself through the use of screens, right? I mentioned earlier ways that I can use screens to numb, or ways that I can use screens to increase my level of arousal. Those are ways to shift my nervous system into a different state. If I'm not getting co-regulation from another person or a series of other people, I'm more likely to need it in some way, and screens can be at least on the front end, a functional tool for that until it becomes a problem. The other end of this, and I have seen cases of this, is where if kids get too much screen access too early, they will start to default to using their screens to manage their discomfort as opposed to using other people. And I believe I've seen cases of that where their dependence on the device looks more like they're in relationship to an attachment figure as opposed to I'm using something to have fun. So it's not only that there is some kind of trauma or abuse or breach in the attachment relationship between parent and child, but that excessive screen use can functionally start to kind of cut somebody off from their support system. This is what's called the autonomic ladder. This is based off of Stephen Porges's work, who created polyvagal theory. I highly recommend his stuff. I use these kind of images a lot with families because it's a way visually to describe what's happening. I'll go through this quickly. I'm conscious of our time, and I'm going to do my best to leave some time for questions at the end. So with someone who's in the middle of an active addiction with screen use, likely what's happening is they're going to be in sympathetic activation, which is that guy in the middle. And when we're in sympathetic activation, when we're in fight or flight, what that means is that my brain is fixated on looking for threat, and I will see anyone and everything through that lens. So if I'm already highly aroused and my parent comes along and says, hey, buddy, do you want to go outside and play catch? I'm going to respond to them, filtering them through threat, and probably become really irritated and dismissive and not be very interested in that, because my nervous system needs to be at a lower level of activation, which in polyvagal theory we would call ventral vagal, which means that things are moving slowly enough and I feel safe enough in my body that I can see others as a resource of connection versus threat. And my nervous system will need to be in that state before I'm available for connection. So if kids are highly stimulated from their screen use, it's not a good time to try and connect with them, is the takeaway there. We have to do something that changes the state of their nervous system before they're going to be ready to do that. I got a couple more slides here talking about some of the problem areas, and then I'll talk about treatment. So there's some good research being done on some of the impact on the developing brain with excessive screen use. And one thing they're finding was a good study I found coming out of China, was that for kids who get too much screen use too early, there's a negative alteration in Broca's area of the brain. Broca's area is a region of the brain that's responsible for speech and also responsible for the regulation of our breathing during speech. In that study, what they found is that kids who get too much screen access too early are more likely to present alexithymic, which is the clinical term meaning not having words for feelings. So they have feelings, there are sensations happening in their body, but there's a real inability to be able to articulate what's happening for them, which is obviously problematic. The other is a negative impact in folks' theory of mind abilities. Theory of mind is the ability to know that and to have in my conscious awareness that other people have their own mind and therefore their own desires or wants or needs that sometimes might conflict with mine. And if I have that information in my consciousness, that means I can behave in a way that feels considerate or has some, quote, empathy to it. I'm connected to the impact of my behavior on others because I'm aware they have their own mind. They're finding that that's pretty diminished in kids that have excessive screen use too early, which is also, I think, part of the reason that sometimes folks who are screen addicted get misdiagnosed as being on the autism spectrum. So a couple things I want to highlight here is that Screen addiction, when it's in its sort of highest state of having an impact on someone's life, very much mirrors the traits and symptoms of ADHD, and in some cases autism spectrum as well. Part of that, again, is because there's going to be serious deficits in the person's executive functioning. They're not going to be able to concentrate very well. They're not going to, again, have high levels of distress tolerance, which can show up like hyperactivity or inattentiveness. So what I want to stress here is that if there's a young person in your life, or you're working with folks who are coming in wanting to get tested for ADHD, it is essential, crucial, that their screen use is evaluated as part of that. And if you discover that their screen use is excessive or compulsive, until you get them into a state of abstinence from that particular behavior, you're not going to be able to tell what's producing the symptoms between screen addiction or ADHD. So what I typically recommend is you're gonna want to get a month to a couple of months of abstinence to see if that cools down some of the symptoms that are showing up, or you can tell if they're being produced organically. But for parents, if you're walking into a practitioner's office, that we only have the information to go on at the time that's presented, and not everyone knows to ask about this stuff. So it's essential that the person's screen use is evaluated. The other thing I'll mention is that sometimes what presents as screen addiction could be autism spectrum disorder, and the person's attempts to stim have gotten sort of wrapped up in screen use. So sometimes a lot of smartphone use or gaming could be a combination of visual and tactile stimming. So if you are going to try and change their relationship with screens, it's just important that you have some other opportunities to stim that are non-screen related on board, so you don't create a bad situation or potentially unsafe situation for that person. All right. So I'm going to give a quick overview of treatment, and then I'll talk about prevention, and then I'll wrap up, and hopefully we'll have some time for questions. Treatment is basically in three parts. One is a brain and physiology reset, or a detox, you might hear it referred to as. The second part is bringing in some pro-social affect regulation, which means we're trying to get this person to lean into some non-screen related activities and get them to lean into social support and healthy opportunities for attachment. And the third is we want to be able to address some of the developmental milestones that have gotten missed or arrested as a result of the addiction, and to address any kind of family dysfunction that may be precipitated the screen addiction, because sometimes that's a factor as well. The first part of this is an abstinence period. So very similar to other kinds of addictions, some level of an abstinence period is necessary to get the brain out of a compulsive state and into a healing one, and also to let this person's nervous system slow down and reduce the level of stimulation that they've had access to, which is also ideally going to result in more consistent sleep patterns as well. So some quick pieces about abstinence. Abstinence is what it sounds like: total abstinence, no phone, no games, no TV, etc. There's not a perfect exact science to how long the abstinence period needs to be. I'll give you some references. So it's dependent on the person's age and how long they've been addicted to screens. Typically, the older they are and the longer they've been addicted to some form of screen use, the longer the abstinence period will need to be, compared to maybe a child that's 9 or 10, and this has only been a problem for 6 months. The abstinence period can probably be shorter. In Dr. Dunkley's book that I recommended earlier, Reset Your Child's Brain, she uses a 3-week model of abstinence. Her content is definitely geared towards elementary to middle school aged kids. I've had some success doing 3-week or 4-week periods of abstinence with those folks. There's another person I'll mention here, and that's Dr. Hillary Cash, who runs the only residential treatment facility in the United States for screen addiction. It's called Restart Life, and it's in Washington State. And her program, she uses a 90-day model. And I would say that's closer to what's needed for older teenagers that I've worked with, who might be somewhere between 17 to up to 20. Usually a couple months of abstinence, especially if the problem's been on board for a while, is more necessary. The last thing I'll say about abstinence periods is it's it's imperative that you have a safety plan involved before you start. And it's best to treat this as a family experiment. So if there's one kiddo that, quote, has the screen addiction, that means everybody else in the household, when we do the abstinence period, is going to participate as much as possible, which looks like, taking the TVs down, locking up the devices. Most adults have to have some screen access to some degree to do their work. And I get that. It's best that not happen in front of the person who's in the abstinence period, for the same reason that if you had someone in detox from alcoholism, it's best to not have a bunch of people drinking around them. Same principles apply. It also is helpful from the perspective that, in my experience of doing abstinence periods with families, if we all put our screens down, we're more likely to do what comes naturally, which is to connect. And sometimes that is the piece that was missing, that was kind of precipitated the need for the addiction in the first place. So with that, it's super important that the parents have to have united front about being ready and willing to set serious boundaries when it comes to screen use. Until that's achieved, there's no point in starting an abstinence period. So for me, a lot of times I end up being sort of a coach for the family system to get through something like an abstinence period. And if that happens well, and good supports are put in place, and we're able to reestablish balance in this person's life, they're not going to be interested in pursuing a bunch of other non-screen related activities at first. They'll need their parents and the people around to shoulder that burden for them initially. So I usually mention that the abstinence period is typically more challenging for the parents than it is for the person who is screen addicted. There are definitely some other tools involved when it comes to treatment. Group therapy and group level interventions is definitely cutting edge treatment for folks who have addictions for a lot of different reasons. There are also, so I think I have this. There's also 12-step programs for folks who have screen addictions. The one I have the most experience with is ITAA, or Internet and Technology Addicts Anonymous. Somewhat ironically, they only have meetings virtually, but it is relatively a new 12-step program. So they're still gaining some traction in terms of their volume. But I have found it helpful for some of the clients I've worked with. This is what's called check my time here. I'm going to do my best to wrap this up. This is what's called a 3 circles exercise. And the purpose of this is it's a way to define recovery for a person who is addicted to something that they're not going to be abstinent from forever. So similar to things like food or sex, when it comes to addiction recovery, the goal is not abstinence forever. Someone will have to re-engage their ability to use screens to move through the modern world. There's just no getting around that. So what the purpose of the 3 circles is, the inner circle are behaviors that were taken off the table, some temporarily, some permanently. The middle circle are behaviors that might be sort of gray area or warning signs that I'm moving closer to a behavior that's been problematic for me in the past. And the outer circle is, what does health and balance look like for me? So this is a way to very concretely separate what is addiction versus what is my life being in health and balance. It's a good tool I've used with a lot of folks who have screen addictions. I've also found it pretty helpful for young people, whether they have a screen addiction or not, when trying to conceptualize like what is health versus what is compulsivity. And in the interest of time, I'll mention this and then I'll talk about prevention and then I'll stop. So this is an example of, I mentioned earlier about distress tolerance and also needing to have people find a way to change the state their nervous system is in so that they can navigate the world, make connections, et cetera. Found some good research that when it comes to successfully moving up and down that autonomic ladder that we talked about earlier, something like cyclic sighing, or what might be called cyclic hyperventilation or hyperventilation or box breathing, is much more effective than mindfulness. And to give a quick example of this, that would be, I breathe in for 4 seconds and I breathe out for 6 seconds. The important piece of that is when we exhale longer than our inhale, our nervous system sends a signal to our brain that says, I'm safe. And it's okay for me to go to rest and digest, as opposed to perceiving threat. And if we do that over and over again, let's say for 5 minutes, breathe in for 4 seconds and out for 6, it's going to start to drop the level of activation that's in my nervous system. So I highly recommend that for sure. So what I've got here at the end, this is a list of recommendations for what would be appropriate screen use as someone moves from birth up until 18 years old. This is not the world according to Mike. I've taken research and suggestions from the American Academy of Child and Adolescent Psychiatry and the Academy of Pediatrics. I've taken their recommendations, and I've also added in a little bit of wisdom I picked up from my own practice, and this is what I came up with. You guys are going to get a handout that has this information, so I'm not going to read through it. The one part I will hammer home, and if you don't take anything else away from today's presentation, I want you to take this. The concept of earning more screen time is faulty. It activates the addictive process, so take it out. What works much better is to have these are what the screen boundaries are, and they are unchanging based on your good behavior. Otherwise, what happens is all of the young person's behavior that might be positive in school or in the home or socially is geared towards getting this big, juicy, ripe dopamine experience at the end, which is what activates the addictive process. And they're going to miss the inherent benefits of engaging in those behaviors otherwise. So take earned screen time out. There's also some suggestions when it comes to parental intervention that's effective for managing screen use, and that'll be included in the handout as well. And I'm conscious that we got about 3 minutes left here before we have to wrap up. So I'm going to stop to see if we have maybe a couple questions I can take here at the end.
All right. Thank you, Mike. Very interesting. So what one question out there is, what screen time limit do you recommend for 11 and 12-year-olds? Oh, I'm sorry, 9 and 11-year-olds.
So from kids 6 to 12, what I would recommend is 90 minutes of passive screen use a day, which would be, again, passive screen use would be like watching a TV show or a movie. Mm-hmm. As long as you can, it's best to completely delay any interactive screen use, like having a phone, a tablet, or gaming up till 12. If you do start prior to 12, no more than 60 minutes a day of interactive screen use. I think the question was for a 9 or 11-year-old. So yeah, that would be my answer.
Okay, and knowing that screen time in our day and age is inevitable, what are age-appropriate alternatives?
Age-appropriate alternatives for what? I want to make sure I understand.
Understanding that screen time is inevitable. I mean, what do you do to kind of combat that? And then how do you communicate that to maybe some caregivers such as daycare or babysitters?
I'm not sure I'm interpreting the question correctly. Like, what other activities can kids do than be on screens?
Exactly. Yes.
So the stuff that it's always been, right? Okay. Playing sports, engaging in arts, playing games together, board games, etc. So what I think might be behind that question is kids who are already a little dependent on screens and having a hard time showing interest in other activities. What works best, in my experience, if that's the case, like let's say I have a 10-year-old and they have a lot more screen time that's listed in this suggestion. What works best would be to do a brief abstinence period and then reset the boundaries around screen use with some more emphasis on non-screen related activities than it would to just move towards the new boundary. Because what's going to happen is because they've developed tolerance, they're going to get really agitated.
Okay. Okay. And then do you have a few pearls for pediatricians in treatment that they can recommend?
Yeah. So some good questions to ask. If you're working with someone who you think might be screen addicted, would be a question I use often is, how does your body communicate to you that you've had too much screen time? How do you know you've had too much? And what that can do is start to begin a conversation of like, how connected to their body is this person, A, and B, are they aware of the physiological signs and symptoms that tip them off that they've become excessive and it's starting to change their level of arousal in their body? So it's a good question to start with. Another that I use often is just have phone, especially if you're working with people who have phones, have them get their phones out and actually look at the screen time data that their phone gives them. Don't just ask people how much time do you spend on your phone, because most either don't know or minimize it.
And then knowing that many schools, have their kids use screens, right, all day. And knowing that, how do you approach that where it's okay to do screen time at school, but not at home?
It's a very challenging area for folks I've worked with who are screen addicted and need to either do an abstinence period or change the amount of screen time they get. Oftentimes, school is the biggest barrier. So I have often had to write letters, call principals, have meetings with teachers to try and create some advocacy for them to take this seriously enough to consider going screen free with some of their content in school. And in some cases, the school is so tech dependent that's not possible. This could be a whole separate talk for sure, this topic, but it is a really serious barrier in a lot of cases.
All right. We're a little over, so thank you so much, Mike. Very interesting.